How do we enhance lactation postpartum? Immediately after delivery and moving forward, how do you enhance lactation to ensure you're constantly producing milk that is sufficient for the baby? So we want to talk about some aspects that can help you to ensure that your breastfeeding is effective, that your milk production is effective. And so we start from immediately after birth. So after delivery, your midwife will tell you to breastfeed less than an hour after delivery. Breastfeeding less than an hour after delivery is always a great thing that comes in to provoke the hormone called oxytocin. This hormone oxytocin, it is the hormone that pushes out milk, so it helps the glands to squeeze the milk out, and this one is a very good way of enhancing lactation. So you want to produce milk as early as possible to start breastfeeding. Remember, you breastfeed immediately. The baby should start feeding immediately to avoid dehydration and the other effects that come with less breastfeeding, even jaundice. So the breastfeeding in less than an hour after birth, unless if there's an issue that could maybe make the midwife stay serving you or trying to deal with you before delivery. The second thing that does is the skin-to-skin contact, whereby you, as the mother and the baby, you have a contact of skin to skin. And that one, in the first, after delivery, immediately it's done by the midwife, whereby they just place the baby on your abdomen and the naked abdomen. So this one promotes bonding, and bonding also stimulates oxytocin to come down, the love hormone, oxytocin. The moment you experience the baby on your abdomen, there's a way oxytocin is highly produced, and this one helps to push the milk out as early as possible. So it is a way that the midwives will do, but also after delivery, whereby now you are the one with the baby. Ensure to do as many skin-to-skin contacts with your baby as possible. So you just get the baby inside your cloth, and then the baby, you just have a skin-to-skin contact with that baby. And this one promotes milk production through hormonal manipulation. So that is a very good way of promoting milk production. So do it at home, do it even when you're in the hospital before discharge. It will help that milk to start coming down earlier. And of course, as you do that, remember you're taking drinking, rehydrating yourself well, and especially water. Water is very good for milk production. It helps you, even your body itself, to respond so well, because a body that is hydrated, it ensures even the cardiac or the heart's output to the brain is very sufficient. And this one, when the brain is functioning well and is able to sense that you have a baby, and it signals the hormones to bring in that milk production and also the milk output. And then in addition now to the water intake, remember the nutrition. You need to have nutrition that is full of good proteins, calcium. You also need to take vegetables and fruits. Take nice nutrition that is good for your body and that will give you the nutrients that are required even to pass to your baby. The other thing that you are doing, you can do to increase lactation or milk production, remember you need some support. So always ensure that you get support where it is needed so that you can be able to rest. A person without rest may have some stress. The moment you have that psychological stress due to maybe getting too tired, you are exhausted, you're physically exhausted, this one could reduce milk production. So always ask for help and then rest efficiently. As we say about sleeping. As we talk about sleeping, we say that you need to get some adequate naps that can help you to be able to have a mentally healthy postpartum period. Because some women get stressed due to postpartum fatigue, whereby you are so tired. So ensure you get that adequate rest. The other thing that you need to do is to take the supplements that you're given by your midwife or your doctor. And if you don't have some, remember you can take some. There are some herbs that are known to increase, like the fenugreek seeds, and whereby you just take them and you're there, and you can just ask for those nice things that are used in your community. Remember, we acknowledge the community and what the community believes in and what they find important and good for the women that are breastfeeding. As long as it is healthy, just seek what is available in your community that can support lactation. This is very important. The community aspect is always an important aspect of maternal and newborn care. So get to know what happens. If possible, get into social groups, get into places where you can ask midwives, you can ask other women. It is always a good thing to do. Of course, you also want to learn more. Always ask questions where they need to be. And of course, deal with your psychology very well. Ensure you are psychologically stable with your family. You are happy with your family. And just ensure you are stable psychologically for your own good and also for the baby's own good. Remember to keep monitoring and checking on your kids to ensure that they are getting full, so that you don't assume that you're really having good lactation, but yet it is not yet well established. So always monitor. If you find the baby is looking dehydrated, the skin is dry, or any changing of the skin color of the baby, always good to consult and to ask for help. And of course, the last thing that you need to do is you attach your baby well to ensure you don't get cracked nipples. Remember, cracked nipples will give you a discomfort, which will cause an effect on your milk production. So ensure you don't have to attach wrongly. And also, yeah, breastfeed as many times as possible. Breastfeeding itself is a way of promoting milk production. The many times you breastfeed, the more you breastfeed, the more the production occurs. It's like a factory whereby you realize there is a lot of consumption of the product, and then you produce more to ensure there is more to be sold or to be used. So ensure you breastfeed as many times as possible and enjoy the parenting time. Take care of yourself, take care of the baby to avoid any complications that could come in. And of course, keep consulting your midwife and your doctor to ensure that you are okay. Wishing you all the best in your breastfeeding journey. Any questions, you can always send them on the comment section and we can always be able to answer them to you. Thank you and have a good time.